Hi, Phil Borders, psychiatrist at Hendricks Therapy. Today we're going to look at some general questions about psychiatric medications, and these are questions that pop up from time to time. Question number one, will this medication fix me? And I think you know the answer to this question. Of course it won't fix you. Life is way too complicated. People are way too complicated. There's way too many variables, way too many issues for any medication to fix anyone. Can these medications have substantial positive impact? Absolutely. If you have depression, anxiety, OCD, schizophrenia, bipolar disorder, whatever, these medications can help people feel and function much better. And they can also help people perform much better in therapy because their brain's working better. For stimulants, I'm not going to address the general question, are stimulants overprescribed in our society? What I can tell you is my own personal experience and with our office is we look at objective and subjective criteria for ADHD. We have a computer program that actually can give us objective data whether or not somebody has ADHD, and if they're appropriately diagnosed, then they're appropriately prescribed. Question number two, will these medications turn me into a zombie? By zombie, if you mean, will these medications turn me into a soulless corpse? No, they won't turn you into a soulless corpse. No, neither will they make you a walking dead. Now, most people, when they say, well, turn me into a zombie, they mean, is it going to make me, sedated? Is it going to make me zonked out? And you know what? It's possible. There are some psych meds that are quite sedating, and they can make it where people feel sleepy all the time and make it hard to function. And you try to avoid that. You try to avoid it by, starting off with low doses, going up slowly. But some people are real sensitive, and you can make them a little bit changed and make them sleepy. So if that happens, you either reduce the dose or change the medication. Will these medications change my personality? Now, you're probably expecting me to say no, but times it can happen. Not very often, but it can. If the medications are really sedating, yeah, the person can feel kind of flat, kind of blah, kind of lifeless. I've had some people on antidepressants, which didn't make them feel sedated, but they felt numb. They said, I don't feel depressed, I don't feel anxious anymore, I just kind of don't feel. And that nor is sedation, is that going to be acceptable? So with those kind of side effects, again, you either lower the dose or change the medication. I've had a couple kids on stimulants where they were like hyper-focused, they lost a little bit of their spark, and that's not an acceptable outcome. So with that, again, lower the dose, change the medication, side effect goes away. Are these medications a crutch? I'd like to put it a little bit differently. If somebody is looking for a pill to fix them and they're fixated on the pill, then I think that actually sometimes medication can do more harm than good because the person's just totally fixated on the medication. They're not interested in making changes. They're not interested in personal growth. They're not interested in looking at themselves. So I think medication can sometimes actually be a hindrance. And if that happens, you basically just address the issue and, bring the person back to reality. It's like, the medications can help, but you got to do your part too. Will these medications, will other people notice that I'm taking them? They might notice that you're doing better or feeling better, but they're not going to be able to notice that you're taking a pill, again, unless it's making you sedated and making you drool, making you slur your words, then they're going to notice. But again, that's something where if that happens, you back off and you change the medication because you don't want people to feel and function that way. Last question, will these medications make me addicted? And that's kind of a complicated question, so what we're going to do is take a little bit more time and address that in our next session. Thanks for listening. Talk to you next time.